Good evening. My name is Alyssa Clace, and here is my larynx model. Right here is the hyoid bone. It is an important site for the muscular attachments of the larynx via the suprahyoid and the infra. And then it is considered the part of the laryngeal framework. And then right here is the thyroid cartilage. It is the largest unpaired cartilage in the laryngeal framework. It has several parts. It has two laminae, two superior cornu and two inferior, and then an oblique line and a superior thyroid notch. So right here, in this dip, is the thyroid notch. Here, right here and here are the superior. Right here is like the oblique line, and then right here is the inferior horn. It is also recognized as the Adam's apple. The angle is wider in females, approximately 120 degrees, and the angle is more acute in males. And then there's the superior and inferior thyroid cornu, and the superior horn of the thyroid cartilage attaches to the hyoid bone right here via ligaments, and then the inferior horn of the thyroid cartilage helps connect the thyroid and the cricoid cartilage, which is right here, but and it's also bigger in the back and smaller in the front to help it attach for other, it's bigger in the back so it can attach for other muscles. Okay. The cricoid cartilage again is the red right here. It is a single cartilage made up of the hyaline tissue. It is connected to the thyroid cartilage via the inferior horn right here and the superiorly of the criticothyroid membrane. Also attaches to the first tracheal ring by the cricotracheal ligament or membrane. The thyroid joint specifically allows the thyroid to rotate anteriorly or posteriorly on the cricoid. So it should be doing like this, like that. So the arytenoid cartilages, which is the yellow right here, they're paired. It is situated on the superior margin of the cricoid lamina, consisting of hyaline and elastic tissue, usually described as pyramidal shape, so it's kind of like a triangle. There's two main processes of the arytenoid cartilage. There's the vocal processes and the muscular processes. The muscular processes extensions where the posterior and lateral cricoid muscles attach, hence the name muscular process. The arytenoid cartilages also serve as the posterior attachment for the false vocal folds. And here is a view on top. And then right here is the epiglottis, the black right here. It helps, actually, before I get to the epiglottis, the arytenoid movements allow abduction and abduction. These movements occur because of the crico joint. Okay. And then now the epiglottis right here. And if you look right here, it goes above the hyoid bone, the superior part of the larynx, so hence why it's a little on top. It is located posterior right here to the hyoid point and base of the tongue. It looks like a leaf in a shape. It is broad as its top and narrow as its base. The epiglottis attaches to the angle of the thyroid cartilage by a ligament called the thoracoepiglottic ligament. Also attaches to the tongue by several ligaments called, and then the epiglottic downward movement to closure is is the biomechanical effect of the hyolaryngeal movement, the downward bolus movement, and the tongue base retraction. And then the laryngeal muscles that are part of the thyroid or the larynx are the entranced larynx muscles, which are responsible for the movements of the laryngeal cartilage and finer control of the laryngeal structures, and the extrinsic laryngeal muscles are responsible for larger laryngeal movements like elevation and depression of the larynx. And with the intrinsic laryngeal muscles, it's found within the larynx, and there's a total of 5, which are all paired. These muscles work to regulate the tension in the vocal ligament and the size and shape of the glottal space. The first one is the thyroid tenoid. It shortens the vocal folds when it contracts. The posterior cricoadenoid, or also known as the PCA, originates on the posterior surface of the cricoid lamina. Then there is the lateral cricoadenoid, or LCA, upper broader. It courses upward and backward to insert into muscular process of adenoid cartilage. Upon contraction, it attracts or closes the vocal fold by moving the muscular process and the vocal process medially. Then there's the cricothyroid, which I talked about, that like moves back and forth like this. It has 2 sections, the pars recta and the pars oblique. They vertically upward to insert into the lower margin of the thyroid lamina. Number 3, the adenoids. Their origin or the posterior surface they course diagonally to insert near the tip of the opposite adenoid cartilage. The oblique and transferred fibers adduct the vocal folds when they contract. And then, as I stated earlier, the ventral vocal folds, which I created like right here, also known as the false vocal folds. They play a major role in preventing invasion of the pathogenic agents. And that is my project. I named him Larry, but thank you, and I hope you have a great night.